Most of us think that a routine urine test is just another test which the doctors ask for no importance of its. But did you know a simple but a small urine test can tell a lot about how healthy your kidneys are? Welcome to another episode of Diagnosis Matters, because every test tells a story. In today's episode, small test, big clues. How a simple urine test tells a lot about your kidney health. We will explain how a basic urine test works, what doctors usually look for, and why it is one of the earliest ways to understand your kidney health. Welcome, Dr. Rajeev, for another episode of Diagnosis Matters. Today, we are going to discuss a very simple test when it comes down to diagnostics or IVD, but it gives a lot of insight into the kidney health of any individual. And we would like to know from you that why this test is this important, the urine test is this important.
Like you just said, that the urine comes from the kidneys. And what does the kidney do? The kidney is actually like the excretory system of the body. And everything that the body processes, or any poisons that enter the body, or any poisons that the body makes, or anything that the body doesn't need, all of it is getting filtered through the kidney and thrown out of the system. So the urine test is an indicator of kidney function, and kidney is one of the most important organs in the body. So that's why though it's a very simple test like you said, but it gives us an insight into what's metabolically happening in the body.
Do you feel that even when a person is healthy, seems healthy, does a urine test can give that something is going to go wrong?
Oh yes, of course. The kidneys will complain only when 1.5 kidneys are dead. So almost 70 to 75% of kidney function will get compromised. That's when the kidneys start complaining and functionally the patient starts having symptoms. But that doesn't mean the urine is going to be normal. The urine will show abnormalities in various parameters a lot earlier. So routine urine testing can pick up kidney disease or kidney function abnormalities much before they are clinically relevant.
Which parameters do you feel are the earliest ones or the earliest signs when it comes down to an onset of a kidney damage, or maybe something which is going to go wrong?
Again, it depends with disease to disease and what part of it's just not the kidneys. You can have a problem in the kidneys. It could be in the ureters, it could be in the urinary bladder, or it could be in the urethra. But I think from a layman perspective, I think the amount of urine that's coming out, that's primarily very important. Somebody is having a low urine output, that's important. High urine output, that's important. Secondly, protein. It's the protein that is present in the urine, that's important, and blood in the urine. From a chemical perspective and from microscopic presence of various casts or epithelial cells or WBCs, all of those become very important. But if you had to hold my neck and say, give me 2 tests that are really important from the urine routine, then I'd say the blood and the protein.
I think with the protein question, I would like to get a bit more into it. Now, if a particular patient or a subject has protein in the blood, in the urine, do you feel that they should be panicking immediately? The first result of a urine has protein.
No, it would depend. There are a lot of reasons why you would have protein in the urine. It's known as proteinuria, and some of it is physiological. Sometimes some of our patients would be having more of protein in that non-veg or high protein diet or something, and then if the body doesn't need it, obviously the protein is going to go out any which ways. Sometimes mild infections, dehydration, all of these can also cause mild proteinuria. It's persistent proteinuria that is a problem, but there's no need to panic when the first instance of protein being present. And some cells get excreted in the urine. Those cells are essentially proteins. So, if you have a lot of urine of cells getting shed in the urine, as a natural process, you could get transient proteinuria. That's nothing to worry about.
India as a major subcontinent when it comes to the global population, diabetes is growing. Globally, it is growing.
Absolutely.
Could you give us an interrelationship between a diabetic patient and how important is urine test on a regular basis to be done for them?
Okay. Diabetes by itself doesn't trouble the patient. Sugar is within the system, within the body, within the blood, and the patient makes no difference to the patient. It's what diabetes does to the organs that makes a difference to the patient. And one of the most important thing it does is damage the kidney. And that's an irreversible damage with the end result leading to an end stage renal disease. And the only hope probably is renal transplantation or repeated dialysis. Now, one of the early markers of renal damage, especially with diabetes, is the presence of protein in the urine, and within that there is a subset called microalbumin, which will pick up the smallest fraction of albumin. Normal albumin is a very heavy protein and will get secreted or will get excreted when the damage is significant. But early damage leads to very minute pores, and these are in the form of, and through these pores you will have microalbumin coming out. So if you're going to test these patients persistently for microalbumin, you're going to pick up kidney damage at a very, very early stage, which means you can have lifestyle modifications, you can have change in treatment, you can have change in therapy, change in diet, a lot of things that can help to delay the onset of kidney disease.
Now, coming to, because microalbumin, I think it's a very important point you have to. A high risk patient already who has known, maybe a known diabetes or has some kind of kidney disorder has been detected. What is the frequency of a urine test they should be keeping on doing?
With diabetics, with good control, I'd be happy with microalbumin test being done once every 6 months. But if your control is not good, if the sugars are persistently high, if the glycemic index is high, the glyco-HB shows poor compliance, then I would prefer a urine test to be done, at least for microalbumin, once in 3 months.
Now, coming to, means the industry is changing. IVD, or basically the in vitro diagnostics, is changing. At your immense experience level, how has automation improved urine detection or urine science, basically?
Okay. The urine test started out as a very crude test where you mix chemical 1, chemical 2, and you look for color changes, and it was very subjective. I find it orange, somebody finds it red. So from there we moved on to strip based testing, where a definitive color change was there, and depending on the color change you could grade. Again, a little bit of subjectivity because it was time dependent. Maybe you take the reading at the wrong time and you would have this. With automation, that's gone. If a reading has to be taken at 60 seconds, it's taken dot at 60 seconds. So that's standardized the whole thing. That's part number one. So you're getting much more standardized results. And now that you have automation with urine microscopy also, so it's much more faster, much more efficient for a pathologist, because there is one layer of screening that's happening by the automation system, and that highlights important areas within a slide that the pathologist needs to look at. He can now pick up those cells, correlate that clinically, analyze it, and then accordingly advise the clinician that I see these new changes over here which are not there last time, or these are significant, so you need to look at this patient from this perspective. So automation definitely help, because your efficiency as a pathologist increases, your throughput as a pathologist increases, and you are doing much more than routine work. You're actually picking up the difficult cases which initially you didn't have time for.
Do you, means I think with this automation scenario, what I would also want to understand here, there's a population which basically fears getting tested. What are the myths which you would like to blast out from the population, that urine testing is something which is really simple?
I think nobody should be scared of a urine test. There's no needle going in. You are anyway throwing the urine into waste. Just collect it in a bottle and give it to us. So there's no need to be afraid of a urine test. My only advice would be, get it done from standard labs. Get it done where you know there's a pathologist over there and somebody qualified and competent is looking at the whole system.
Since the competency and everything has come, if there is an abnormal sample, how would you talk about a follow-up mechanism for the patient? Because finally it is their health we are talking about. So an abnormal sample in the first or the second scenario, how is the general follow-up they should be happening?
Again, it depends what's the disease process. If you're looking at something as simple as a urinary tract infection, then symptomatically patient finds relief once you start antibiotics. And then just to make sure that the infection is cleared out, you're going to have a follow-up test and say, okay, now everything is okay. It's more for the mental peace of mind of the patient, because he's seen an abnormal urine report and then he sees a normal urine report and he feels, okay, I'm okay. When it comes to chronic diseases, if there is something like a glomerulonephritis or glomerulosclerosis, then continuous monitoring depending upon the stage of the disease becomes very important. And in this case, it would be the prerogative of the clinician to also educate the patient that I'm expecting this over a period of time. If there is changes, please come back to us. Please send us this thing. That will help the patient also. The fears become less. They are more educated. They're more aware of what's happening in their own body, and it helps the clinician also because he's picking up the patient because before the complication has happened.
Now we have basically talked about quite a bit amount of abnormal cases. Now, healthy people who are healthy, do you feel there is a requirement of regularly doing a urine test during a regular checkup?
I think yes. For urine, I would say definitely. For some things, I would say no. For example, if you ask me, does a patient need an X-ray chest? I would say no, because the lung reacts almost immediately. If there's a foreign substance that goes in, you're going to cough and cough and cough, and then you need an X-ray. But with the urine, like I said, 70 to 75% of the kidney needs to get damaged before you actually pick up clinically that the kidney is damaged. So periodic testing of the urine is only going to help you because you'll pick up kidney damage before it's clinically relevant. So with urine, definitely, even if you're completely hale, hearty, healthy, you think there's nothing wrong with you, I'd still say go for a urine test once a year.
So, डॉक्टर राजीव, यहाँ पे एक मेजर सवाल आ जाता है कि जब हम बात करते हैं एक आम आदमी के केस में उसको किडनी रिलेटेड हेल्थ के बारे में क्या समझ होनी चाहिए, बेसिक अंडरस्टैंडिंग, बेसिक क्या समझ होनी चाहिए ताकि वो अपना ध्यान रख सके आगे?
तो किडनी बॉडी का फंक्शन का ये काम है उसका कि नॉर्मल जो है जो जितने भी टॉक्सिन और पॉइजन हमारे बॉडी में जनरेट होते हैं उसको बाहर फेंकने के काम किडनी की है. किडनी बाहर फेंकती मतलब यूरिन से ही बाहर फेंकेगी, पेशाब से ही बाहर फेंकेगी. तो पहली बात तो अगर आपको आपके पेशाब में ही आपको अगर कोई भी तकलीफ दिखी, पेशाब पीली हो गई, पेशाब कम हो गई, पेशाब करने के टाइम पे जलन आ गई या पेशाब के कलर में आपको कोई अलग ये आ गई, तो आपको तुरंत सावधान होनी चाहिए कि शायद ये मेरा किडनी इफेक्ट हो रहा है या मेरे सिस्टम में कुछ तो गड़बड़ है. तो तुरंत उन्होंने खुद से यूरिन टेस्ट करके कोई मतलब नहीं है, उन्होंने डॉक्टर को मिलना चाहिए, डॉक्टर से बात करनी चाहिए, ये मेरी तकलीफ है. सेकंड चीज है, कभी पैर में सूजन आ गई, कभी आंख के नीचे सूजन आ गई, ये भी एक कारण है. कई कारण हो सकती है कि ये सूजन आने के लिए, लेकिन एक कारण ये भी है कि किडनी डैमेज हुई है. इन ऐसी अवस्था में भी कभी भी पेशेंट डॉक्टर के पास जाके तुरंत दिखा के फिर अपनी यूरिन टेस्ट कराए.
बिकॉज आपने बताया कि कुछ पर्टिकुलर कंडीशंस होते हैं जहां पर ये पेशाब की टेस्टिंग होनी चाहिए. किसी को एबनॉर्मल रिपोर्ट आ गया, इस रिपोर्ट में कुछ खामी दिख गई है, तो उसको क्या करना चाहिए, आगे का स्टेप क्या होना चाहिए?
डॉक्टर के पास जाना है अभी. और डॉक्टर मतलब गूगल डॉक्टर नहीं, अच्छे खासे जो फिजिशियन डॉक्टर है क्वालिफाइड, उनके पास जाना चाहिए. वो देख लेंगे और वो ट्रीटमेंट कर लेंगे.
भारतीय परिवार और मे बी द ग्लोबल पॉपुलेशन को आप यूरिन रिलेटेड हेल्थ और रादर मैं बोलूंगा किडनी रिलेटेड हेल्थ के बारे में एक मैसेज क्या देना चाहेंगे?
देखिए, हर बॉडी के हर पार्ट इंपॉर्टेंट है, लेकिन उसमें मुझे लगता है कि किडनी की बहुत बहुत ज्यादा जरूरत है. मेरा ये सोचना है कि हार्ट फेल हुआ तो मौत श्योर है, लेकिन किडनी फेल हुआ तो सफरिंग श्योर है. तो इसलिए किडनी की हेल्थ पे बहुत ज्यादा ध्यान देनी जरूरी है. और इस हिसाब से आप एक तो ईट राइट, खाइए अच्छे से, न्यूट्रिशियस और हेल्दी खाना है, हेल्दी रहना है. आपकी पूरी डाइट सिस्टम या हेल्थ सिस्टम, स्ट्रेस नहीं लेना है, ये सब तो आपको शारीरिक के लिए ये करना ही करना है. लेकिन थोड़ा भी आपको लगा कि आपकी यूरिन में कोई तकलीफ आ रही है तो तुरंत उसको निग्लेक्ट ना करें, क्योंकि आप जैसे बोल रहे इंडियन पॉपुलेशन में जो भारतीय संस्कृति है उसमें खुद का हेल्थ पे हम कोई ध्यान नहीं देते हैं. पेरेंट्स है तो बच्चे की हेल्थ पे हम बहुत ध्यान देंगे, मदर है तो बच्चे के देखेगी, वाइफ है तो हस्बैंड को देखेगी, लेकिन खुद में कोई तकलीफ है तो वो इग्नोर करेगी. और कभी कभी हमें शर्म भी आती है किसी को बोलने में कि मेरे यूरिन में ये तकलीफ हो रही है, या हम हिचकते हैं क्योंकि ये थोड़ा प्राइवेट, यूरिन कौन डिस्कस करता है. तो इसलिए कोई हेजिटेशन नहीं होनी चाहिए, किसी ने कुछ ज्यादा सोचना नहीं चाहिए. यूरिन में प्रॉब्लम है, तुरंत आप डॉक्टर के पास आके दिखा दें.
मीन्स आई थिंक आपने एक बहुत सिंपल लाइंस में आपने जो बता दिया है इज दैट अ किडनी फेलियर कैन बी अ वेरी साइलेंट सिनेरियो इफ द टेस्ट ऑफ यूरिन इज नॉट डन ऑन अ रेगुलर बेसिस, वेदर हेल्दी पेशेंट हो या फिर किसी को ऑलरेडी पता हो इसके बारे में. सो पेशाब की या फिर यूरिन की जांच करते रहिए ऑन अ रेगुलर बेसिस, ताकि किडनी में अगर कोई डैमेजेस हो रहे हैं तो वो डैमेज को आपको पहले पता चले एंड यू प्रोलॉन्ग अ हेल्दी लाइफस्टाइल व्हिच इज देयर.
और आज की जो लाइफस्टाइल है हमारी, जो हम खाते हैं, जो हवा ब्रीथ करते हैं, उसमें इतना पॉइजन और इतना टॉक्सिन वैसे ही है. हमारे पास जो वेजिटेबल आता है वो 100% साफ होगा, उसमें कोई पेस्टिसाइड नहीं होगी, ये कोई गारंटी नहीं है. इसका मतलब है हमारा किडनी ऑलवेज अंडर प्रेशर है, कभी भी नॉर्मल से ज्यादा उसको काम करना पड़ रहा है जो गंदगी हम खा रही है उसको साफ करने में. तो हमें इस चीज की कभी भी देखभाल करनी चाहिए. सिंपल सी बात है, अगर हम बाहर जा रहे हैं या कोई काम कर रहे हैं, हाथ मैले हो गए तो हम तुरंत उसको साफ कर लेते हैं, पैर मैले हो गए तो तुरंत साफ कर लेते, लगा तो हम एक जाके बाथरूम में जाके हम पूरा हम स्नान भी कर लेंगे. किडनी के लिए भी हमने उतना ही देखभाल करना है. हमें लगा कि हमने कुछ अनहेल्दी किया है, कुछ गलत खाया है, तो हम तुरंत उसको करेक्ट करके किडनी को ठीक ठाक रखना बहुत जरूरी है.
ये ओवरऑल आपके थ्रू जो डिस्कशन आया है एंड एवरीथिंग व्हाटएवर यू हैव टोल्ड अबाउट किडनी हेल्थ एंड उसको कंटिन्यूड या फिर सस्टेन्ड तरीके से रखना, दिस इज very very important for means आम आदमी and everybody, the entire global population, what I would say. And really thank you for giving your time here.
No problem. The pleasure is all mine, and I think kidney disease is very important because it takes a real big toll on the entire family. Dialysis, transplantation, all of these are major headaches for a typical Indian family or for anybody. It increases mortality, it increases morbidity, and the best part is we can prevent it, we can prolong it, we can avert it, and all with the help of a simple urine test.
Thank you so much,
Thank
Dr.
you so
Rajeev.
much. The pleasure is all mine.
A simple urine test may look small, but it gives a lot of big clues about your kidney's health. Paying attention to the signals can catch problems sooner and help you in the long run to have a healthy life. If you found this video insightful, please share with your family and friends. And to watch more of such informative videos, do not forget to like, share and subscribe to our channel.